Hello, everyone, and welcome back to Prevention Talks. Today, we will be talking about providing family-based prevention interventions during COVID-19 and what are the challenges and opportunities for prevention professionals. We wanted to bring this topic to you considering how this pandemic has changed a lot of the dynamics in families around the world and how much or the way that families have been able to adapt and cope with these new realities also depend on their circumstances. Part of what we want to address here today
do some virtual breaks with them. Okay.
Is in what ways we can still support and bring family-based prevention interventions to families as they continue their parenting journey, even when they're in their most vulnerable situations. So for this purpose, we are proud to bring you a stellar panel today. First of all, let me introduce you to Dr. Douglas Coatsworth. He's a Betsy R. Bush Endowed Professor in Behavioral Health and Associate Dean for Research in the College of Social Work at the University of Tennessee in Knoxville. Hi, Doug.
Hi, Maria. Hello, everybody. Thank you for joining us.
Thank you, Doug, for being here. We also have Dr. Kathy Hockaday. She's a faculty member of Human Development and Family Studies at Iowa State University and program manager for the internationally recognized Universal Prevention Program, Strengthening Families for Parents and Youth 10 to 14. Hi, Kathy. Thank you for joining.
Hello. Hi, all.
And we also have Dr. Wadi Malouf. He's a global program coordinator on prevention in the Drug Prevention and Health Branch Prevention, Treatment, and Rehabilitation section in the United Nations Office of Drug and Crime in their headquarters in Vienna. Hi, Wadi. Thank you for
Hello, Mariana. Hello, everyone. Thank you for having me.
So what we're going to do right now, Wadi, we'll begin by making a presentation and providing you with the conversation framework. And then Doug and Kathy will comment on this presentation to expand and elaborate on some of the issues that will be presented. If you have any questions, and of course, all questions are welcome, we invite you to write them on the chat, or you can use the hand raise feature that Zoom gives us, so we can call you to ask the questions. If you want to ask a question, we kindly ask you to be very concise in your intervention for the sake of time and keeping everyone, having the possibility to respond as many questions as we can. So that's it for me. Let's begin. Wadi, thank you so much. The floor is yours.
Thank you very much, Maria Luna. And as mentioned, just to give the framework of the discussion that we're going to have together. So really, as mentioned, this is more interactive than anything else. But I'm just going to say a few words. I'm really honored to be joining Kathy and Doug on this. And,
it's about SSP. I just registered. It's happening now.
So with that context being put in place, maybe it's good to start, the mental framework of what we're going to discuss with the core principles that, dominates what we're going to discuss, which is the prevention standards, at least from our side as UNODC, but that we put for our member states in place. So just to define, because we're going to talk about family skills and drug prevention, the context that the UNODC, WHO prevention standard operate are around these main buzzwords. Discussing them require 3 days of discussion, the content, but mainly we're talking about intervention that are science-based. So there's a lot of science, and that science is in these standards in terms of orienting what works and what does not work. When we say drug use, we're not talking about, just a random decision that's free of any vulnerability that exists outside the individual. It's not an individual choice. We're not saying just programs helping kids, in this context, just say no to drugs. There is, beyond the COVID-19 context, all programming is embedded in a context of evidence-based program, in the context of vulnerability. And that vulnerability goes beyond just awareness and raising fear about drugs. The point of focus is not the drug. The point of focus of an individual growing with individual vulnerabilities and surrounded by structures around him or her that sort of either amplify or attenuate this vulnerability. So basically, we're talking about programs that help the child grow in a healthy and safe way by developing intellectual, language, cognitive, and social competencies that might differ at every age of development. So this is the main vulnerability framework that we're addressing in any prevention program. The individual has vulnerability, different reactivity to stress, different neurological development, different mental health status, different impulsivity, attention, but also that person lives in a context of a family, of a school structure, of peer environment that help or do not help these vulnerabilities. And even this structure exists in a larger structure of maybe a context of an environment of violence, of maybe displacement, of war, of conflict, of poverty. All of these things interact together as a vulnerability framework that influence substance use, but not only substance use. That same vulnerability framework is linked to things beyond it. So this is also good to contextualize that it's not only in the context of COVID-19, but in the context of COVID-19 and the change in that environment and this vulnerability, to contextualize what we're working under in our operation and work. So the prevention standard, when we talk about drug prevention, we're talking about now in the context as Mediscap as a vulnerability framework, programs that span from birth onward. You know, this is where drug prevention can operate. Every age of development have its main milestones of development that needs to be achieved, and different social institutions can play a role at different ages of development helping the children. And what's also important is that, you know, to see the diversity of colors. I mean, maybe the text is too small, but you see there's family, there's school, there's community, and there's different ages. But the diversity of color tells you that also there are prevention interventions that are universal, regardless who you are, where you are in terms of level of risk. That program, if you know, can speak to you and help you. But this is the green color. There are programs that are selective, which is, you know, for subpopulation that probably are at different risk, living in a different risk environment than the rest. And there are programs that are indicated for individuals that probably already show symptom of a problematic behavior that requires assistance in terms of preventing that behavior from escalating to something bigger. So also in that context, it's important to note that in COVID-19 as well, there are populations that are also living in different contexts where prevention intervention needs to be tailored to that context. But going back to this matrix, you see that family is an essential element. Family is key. But that's not to say that family is the only institution that's responsible for everything, but it's an important institution in the developmental perspective because it's an institution that stays in the life of the kids over and over in their growth and needs to change and adapt to the different needs of the kids as they grow. So in that context, we're not talking about parents being police officers to monitor drug use in their children. We're talking about family skills in the context of availing parental support to support the children beyond their own resilience. Avoid harsh, inconsistent parenting because these are predictor of later poor outcomes, and not only drug use, many other outcomes. That's why for us at the United Nations, this is one of these institutions we work with from a sustainable development goal perspective, because it's linked to more than one sustainable goal. And parents need support in the different contexts that they live in. So we're talking about programs that promote communication, trust, problem-solving skills, conflict resolutions. These are the kind of skills that needs to be put in place for healthy and safe development of the children to prevent them from their vulnerability expressing itself in different forms. But these programs that are effective in family skills are programs that allow an opportunity for parents and children to spend time together. So that's an essential component of them. In that context, it's important to start thinking, okay, with the context of COVID-19, how can programs that are designed to build a skill in their nature that need to be interactive, bringing all of these members together with the social distancing applied and physical distancing applied, how can we put them together? That's a core element of effectiveness of these programs, because these programs focus on relationship and behavioral change. And they need practice. Practice in the family and between families sometimes is important in the sessions that are undertaken. The recommendations of the prevention standards also talk about the fact that these programs, in order to be effective in the family, to reflect that change, need to be organized in a fun, easy, appealing way, allowing everybody to participate. The kids to participate with other kids, the parents to participate with other parents, the parent within the family, between families, is an essential component that kind of is a nice flavor to kind of strengthen the effect of these programs. They need to be delivered by trained individuals. In many cases, they don't need a formal qualification, but they need to be trained. Also, an additional complication in the context of COVID-19, where training has to be done remotely in most of the cases, but the programs are not necessarily designed to be trained remotely. Another also important characteristic of this program is they need to include more than one session. You can appreciate the fact that, you know, building a skill as a parenting, supporting their children, to be delivered in one session is difficult. So there's a necessity to kind of you know, have a series of sessions to put in place. Also, something to consider when a lockdown situation is happening and you need these series of sessions to be in a chronological order followed in order to reach that dose effect relationship that you need to reach. How can this be implemented? And as I said, they include the parents and sometimes the children and the whole family are, you know, are as an added. And although there are parenting programs, but you know, a family skills program is a program that brings all the members together, and they carry a different effect because not only the parent is changing, but the children are brought in that family context of change, which also enhances these programs. We know what does not work are programs that undermine parents' authority. Lecturing only as a mean of delivery is not very effective as per the standards. Information only about drugs is not important in terms of an essential characteristics for drug prevention. It doesn't necessarily work by itself. The focus should not be only on the children. The focus should be also on the parent as well. The parent needs to change. And poorly trained staff is a core impediment in terms of making these intervention work. So in that context, it's also important to remember that these parent and family skills outside the context of COVID-19 are common denominator as prevention strategies that are linked for us. For example, I work in the drug prevention field, but as UNODC, as an institution that also works on crime, it's also linked to violence. It's also linked to violence extremism. You would see within UNODC document lots of parenting skills activities linked to more than beyond drug use, but also you'll see in the INSPIRE initiative to end violence against children, which is an interagency platform. Parenting and family skill is one of the 7 strategies. INSPIRE is an acronym of 7 strategies. The P stands for parenting. The violence prevention programming of WHO, the mental health programming for the Helping Adolescent Thrive of WHO, which is a prevention and promotion of mental health programming, includes parenting skills and family skills as one of the mental health developmental issues to account for. So in that context, COVID-19 came in. And now we are living in the stress of COVID-19 as a virus, but we're also living in the context of COVID-19 as social prevention policies around COVID-19, the lockdown, the working from home, the school closures are sort of impeding elements that came as an impeding element for all of us, really, not only for the subpopulation, but probably other subpopulation are accentuated that effect on them. And also, COVID-19 is linked to social consequences of losing work, socio-economic consequences, and beyond. That's adding an additional stress. So, when we had universal programs and selective programs, now practically everybody is parenting under stress. And parenting stress increases harsh parenting. And also, serious mental health issues can also be added as an additional burden. There is co-occurring anxiety that is increasing, and depression in terms of symptoms that is being reported because of COVID-19, making parents sometimes less responsive to children's needs. So there are essential, so now more than ever, and then you see there are call for action from different UN agencies because of the rise of violence against children that are put in place that articulate several strategies where families become key institutions because that's the most functioning institution in the life of the children, but also at the same time a call for action to kind of reduce and alleviate mental health as it occurs globally. So with that general context in mind, this is the general framework of thinking that we wanted to put in place to address specific key issues, questions to discuss together. So in that context, in terms of that value that has added value that beyond COVID-19, family skills program need to exist, but they have a process of implementation. They also, family and parenting skills have a need in the healthy and safe development of children, but also for the sanity of parents as well. So the process has an impediment, while the value is more important than ever. So in that context, maybe we can discuss together how can these programs reach parents with COVID-19 protective approaches? In what format? What can professionals do to reach out to parents, to acknowledge, address their circumstances, and provide them with the very necessary parenting skills? And what new skills and practices can help them face the challenges brought by this global epidemic? So with that, I offer the floor back to my panel members to discuss together in terms of how can we address these issues. And I pass the torch back to you.
Thank you, Wadi. So this is Doug Coatsworth talking. And I want to raise a couple of points that touch on what Wadi has been talking about and presenting, and also these three primary questions. And I want to take a broader view, if I can right now, and that is a couple of things that I'm struck by what Wadi around what Wadi has presented, but also what we're going through right now at this time in all of our lives. And the first thing to note is we know a lot about family functioning and parenting and what works. We've developed a vast literature over the past 40, 50 plus years about what we can do to help build parenting skills and strengthen families. We've done it in a way that we've used the scientific method. I'm a researcher, so I'll talk about how we've learned what works and when it works. And we've developed that knowledge around parenting and families through a particular process, research process, and in particular context of how families
I
are.
need to get some earbuds, don't I?
What we have to recognize right now is the context is entirely different for many of these programs. As Wadi has mentioned, the context of COVID has changed so many things, and our science has not always been able to keep up with that. So I'll use an analogy of generating vaccines. In order to create vaccines for the COVID-19, to treat COVID-19, they had to accelerate some of their research procedures. They had to be adaptable and flexible in how they used their knowledge and applied that knowledge. I think we need to do the same thing with our programs, the knowledge we have about parenting skills, and how we can apply our understanding of what families are going through at this particular moment. And I'll use a basic research example for that. There's a group at the University of Oregon and beyond that has created a program, they call it Rapid EC. And what they did is they started collecting data from families regularly as families were going through this pandemic, as they were experiencing the pandemic. We did not have the foundational knowledge of how families adapt to these kinds of things to inform what we would do with families or how we would create policies to support families. We needed a new way of collecting our data to inform what to do. What we also need is a knowledge about how we can use those data, connect those to the skills and the ideas and strategies that we have for working with families and parents, and apply those in a rapid, flexible, and a useful way that meets families and parents in the moment and in ways that it can be most useful. And so obviously I don't have any specific answers to these, and I don't know that any of us have the exact answers, but it's going to require a flexibility and adaptability and a use of the knowledge that we already have to apply those things. And so what I'm going to ask Kathy Hockaday now to talk a little bit about what she's been doing with the Strengthening Families 10 to 14 program and how it meets some of these ideas and questions that Wadi has laid out.
Thank you, Doug. Hi, I see so many of my sites on here, including all the way Pablo from Chile. I see you on there. I saw you sneak in. So it's so great to see so many Strengthening Families 10 to 14 sites on there. Wadi, in his presentation, led right into the importance of Strengthening Families 10 to 14. Any of you who've used the program understand all the characteristics that Wadi talked about that make family programming truly what it is you need to be trained, you need to involve that whole family, and you need to not just go in and lecture to the parents. And that's exactly what Strengthening Families 10 to 14 is about. As Doug and I have talked, Doug was probably the first person who approached me all the way back in probably April and said, oh my goodness, do we need to take SOP 10 to 14 virtual? And at that point in time, I think we were just taking that noodle and throwing it against the wall and seeing if it stuck. And over time, we've learned that it sticks. And I've been so happy to note so many of you who are on here, the sites that I saw pop up on here are ones who are actually doing virtual SOP 10 to 14. It's been quite the journey, and we are far from being over with the journey, but we've learned so many things along the way. One thing I think that Wadi kind of brought up is, like, with SOP 10 to 14, that what we really push are those peer pressure resistance skills. And what we pulled off of this past year, say, this is not just a substance abuse program. This is really about building family communication, building strengths, working on problems together, showing love, parents truly showing love to their kids, which is needed more than ever. We talk with, kids about the importance of good friends, all those kinds of things that when we are normally, before COVID, we would go out there and try to sell the program. We would really hit home with that substance abuse prevention, the peer pressure resistance stuff and the outcomes. But now we're really going, we have so many other components to the program that are probably more critical in 2020 than they ever were before. But the good news is this: we have, for about 7 or 8 months, we have been doing virtual programming with SOP 10 to 14 all over the United States. Like I said, several of the sites are represented here in the group. And when I was really thinking this morning about it, I've talked a lot to these sites to say, do you think it's better than face-to-face? What do you see that's different, unique? How are the families relating to it? And one of the things that we've come up with is that sometimes those families who we are getting to virtually are ones that we would have never been able to get to face-to-face, which has helped me embrace the fact that maybe this is a long-term thing, that maybe potentially, once we get in doing some evaluation of the virtual program, that it truly might be something we look more into. I know that there's been a lot of news out there right now talking about how kids who might deal with social anxiety, how they're doing better being at home, being homeschooled now and doing online schooling. And I think that we're kind of finding the same thing with some of our groups, some of the families that are coming through virtual programming, is that In particular, I think of one little boy who did not want to ever show his face on camera, but he was comfortable. He was there all 7 weeks, very engaged with the communication, the discussions, things like that. But he didn't want anyone to see who he was. And we've got, I've told some of the fun kinds of stories if we've been able to engage parents and caregivers in places we could have never engaged them before. Last night I was sitting on a program where both the daughter and the mom are in bed because they're both sick, and they would have never shown up to face-to-face. We have in another group, we have a mom who, this was the first time ever, she was working the convenience store counter. She had her phone on, listening to the parent sessions, engaging in between customers. And we've never had that before, but it worked for her. We've had, you know, caregivers who've joined us one time from the pool. The pools had just opened that day. They wanted their kids to be outside of the pool. And so they said, we're here, we're listening and watching the videos, but we're gonna turn off our sound so that we can, you know, so you don't hear all the background noise. So virtually, SOP 10-14 has been able to engage families that we potentially might have not have been able to reach before. I'm just going to kind of end it there because I know that we want to hear from others and engage in that discussion.
Thank you very much, Kathy, Doug, and Wadi. I think this we want to open the floor now to you who are in your homes and your workplaces. But now, it's for many, it's the home. And if you have any questions for this panel, well, this is now the time to ask your questions. So there was Ana Maria Diaz Martinez. She has a question.
Good morning. Well, it's still morning in my side of the country. My name is Ana Maria Diaz Martinez, and thank you all for getting us together to have this conversation. One of the questions that I have is, when we look at whatever our world is going to look like post-COVID and post the pandemic, so how we can address some of this trauma. We can address it, I know, through some of the programming that we do, but to really think about the trauma that's being created now and how that could last and that could carry through with our children and youth and our families. And so I just wanted to have just some thoughts on what might that look like, or what are things that we should be thinking about, because we're going to eventually be there. And how can we utilize some of these evidence-based programs to help work through that? But I think it's a reality. We have to address the idea that historical trauma is being created and will carry through for some time. And it's not just here in the States, it's across the world. And so just some thoughts I'd like to hear. Thank you.
Ana Maria, thank you very much for that question and acknowledging that. We have a whole cohort of young children, a whole generation of young children who are going through this very profound time. And we know what stress and strain and challenges, food insecurity and problems in parenting and whatnot mean for the developing human brain and for experiencing that going forward. So I believe that what we will need to do as a nation and a world is envision different systems that will be able to support children in new ways as they move forward. So trauma-informed care in schools, for example, is an area that is growing in research. How do we integrate some of those things into the existing structures? But it may be that we have to build new structures to support families and children moving forward and dealing with this historical trauma that they've had.
And I'd like to just throw in there, and hi, Ana Maria, is just that I think families are more willing to accept some of those resources and the support that they never did before. There was always the stigma with standing in front of the food pantry and things like that. And I don't believe that, I think we've broken down a lot of those barriers because everybody is dealing with some sort of stress or trauma over the pandemic. And so my hope is that programs that before that we all know are hard to recruit people to, is that hopefully families and individuals are going to be much more accepting of receiving some of that help and some of that support in different ways.
If I may add just a small component as well to this, Ana Maria, because that's a very interesting question also to give you a perspective, because as UN we work with lower and middle income countries, but mostly on lower income countries that are potentially living under a differential stressful circumstances. And the context of trauma and parenting under trauma is not something also only COVID-19 related, but this is something that we've been addressing for quite some time, especially in the context of refugee and conflict settings. Programs addressing trauma are in existence, but I'll give you a specific example of how parenting and family skills have been added to trauma existing programs. For example, there's a program called Teaching Recovery Technique developed by the Norwegian Children and War Foundation, where they were testing with the University of Manchester when we surpass the trauma, how to re-engage between parents and children. It's a program that addresses trauma in children. After you address that trauma, the importance of re-establishing trauma that's war-related mostly, but that's context of stress. How to re-engage in terms of parenting after you overpass this. There has been a 3-arm clinical trial that was done on Syrian refugees in Lebanon, showcasing a wait list of refugees versus people that took TRT as it is only versus TRT plus, adding parenting on top of this and following them up in terms of different sort of scales of mental health, of problematic relationship between parents and children, and impact of events and other things on parents and their children, showcasing how parenting skills after you address trauma, re-establishing this, have supported not only the children but also the parents. So the value of this learning experience for us, just as a segue, we have worked a lot. Because as I said, universally, we're working with many families, but we have directed specific efforts in terms of family living in stressful situations before. As United Nations, we were working a lot in conflict, post-conflict, refugees, displacement settings. And then access, because there are two things to consider in this context. There is the content of the material that needs to be adapted and focus a lot on stress, parenting under stress, how as a parent deal with stress, and how to read the children's stress and how to act on the children's stress. These are components that are not necessarily part of universal family skills program. So the content need to be elaborated. And two, there's the process. Because when you're working in a conflict setting, you cannot reach all of these families. So basically also we try to reach them in an easy way, leaflets, booklets that are linked to kind of overview with a PowerPoint presentation or something that interact, but on a minimal basis, because there's a literacy rate that it might be difficult to read these materials, and there's a difficulty in accessing. So basically we have limited experience in terms of basic needs need to be supported. And then at another level, those that have traumatic experience, because everybody has been exposed after COVID-19. There's a need for all the parents to kind of review reflect on what they're contextualizing, what they're living in now, as you mentioned, post-COVID-19. But there's a need of a subset of programs that addresses parents that have lived in this context in a more traumatic situation. And it's very important to think, yes, in the US, there might be some living, but also, when we say social distancing in a refugee setting is a completely different thing in a crowded setting. And all of these things are important to account for in universal, in kind of global programming to put in place. But you're right. Now, we're living in COVID-19 and we have programs geared to this context. But after this context is a completely different way of thinking in terms of what parents need and how we can engage. And trauma is one of the main elements that we should account for.
Thank you, Wadi. We have a question here from Crystal Tyler, what are the thoughts about continuing virtual programming, for example, Strengthening Families program 1014 post-COVID?
Hi, Crystal. She's one of our sites over in Virginia. We are absolutely looking into that possibility, but we are looking at evaluation first. We want to make sure that we're going to have some outcomes. Obviously, as you know, with the original research, that took years to do. So we're starting off small, but it is something that we are not taking off the table. In the beginning, I think we looked at virtual simply as a very temporary thing. Let's just get through the times. But knowing that people might not want to come back together for a whole nother year, or that, that this might open up a whole new avenue of reaching families, it is definitely something that we're looking into. But again, we're going to look at some evaluation along the way.
And we can say that part of that, people not wanting to come back to get together, is part of that trauma that needs to be overcome somehow, right? I mean, it's that fear of, is it really safe as we think?
Right, exactly.
We have another question from Celia Wilson. She's doing her doctoral research, and she's studying the lack of prevention evidence-based programs in parenting for adolescents and emerging adults. As research shows, many of them are still living with or depend on their parents, and their parents still have some influence with them regarding prevention. What are your thoughts on that? I see Doug is nodding.
So thank you for that question. If I understand it correctly, the question is around the lack of evidence-based programming for adolescents, parents and adolescents, and parents and emerging adults. And I think you're absolutely right. We don't have programs that have been evaluated and tested. There is a vast literature on parenting skills with adolescents, older adolescents. There are parenting practices and parenting strategies and that align with the developmental needs of adolescents, late adolescents, and emerging adults. My recommendation for you would be that that you need to think very carefully about the kinds of strategies that are explored in the literature, and then examine the kinds of strategies that are used in evidence-based programming to support those parenting skills, and trying to understand how they may be adapted developmentally. It's a challenge, but one of the things that I think we have to begin to think about is moving from programs to strategies. There are some common strategies and parenting strategies across the lifespan that you can use and apply them in different developmental contexts.
Thank you, Doug, very much. We have another question from Ellen Walsh. She asked, how are people reaching parents to get them engaged in these programs? And are people having trouble getting to parents to find the time?
I'll go ahead and tackle that one. With family programming, we always have a huge issue with recruitment. Anybody who's ever done that knows it's very difficult for families to come together. We haven't changed our strategy for reaching families during COVID very much, where you still need to get the push out, through social media and flyers and picking up phones and calling people. The problem is we can't go to schools now and sit there and present to parents or to the youth. So that's been a little bit more of a challenge, but we've also opened up new avenues we had never used before. For example, when all summer long that kids were picking up lunches, or young families were picking up lunches at the school in the school parking lot on Mondays, we were having sites throw in flyers to with the school lunches. We had several sites who went to the food pantries and handed out, you know, while they're sitting there in the long lines, handing out flyers to the different programs. So what I've talked to most of my sites is I say, find the families who are willing to do virtual, because it takes sometimes a different type of person to do virtual. You have to have the time, you have to have technology, you've got to have, it's just a little bit of a different, you know, approach. All of us who are on here, we're probably used to sitting on Zoom meetings all day long. In the beginning, actually with some of our families in Colorado that Doug introduced me to, if I recall correctly, there were 2 grandmas. They were like, oh no, don't make us, you know, get on a computer and do Zoom. And we said, your grandkids will be able to teach you. So people are more comfortable with the technology piece of it, but that was a struggle the first few months, making sure people had internet and making sure they had some sort of device. But we have found some new and creative ways to reach those families.
So this is Ellen. So follow up, the families that don't have technology are just not getting addressed. And
No.
are you finding, additional question, are you finding that parents are so overwhelmed right now trying to school their kids online, and then are you finding that they just don't have the time to do another program after a day of working and trying to school their kids online?
Sometimes yes, but sometimes no. We've actually had, I think, a lot more dedicated parents than what we ever expected, just because they're dealing with so much stress with their kids. We've had some, who we've noted, we always have somebody in the car driving around. So within the first week or 2, we try to find out, are they driving because they're driving home from work or getting their kids somewhere, or are they driving around because they don't have internet at home, which happens a lot. And so as soon as we're able to figure out why they're driving around, then we've been able to invite those families to come into one of the offices of the facilitators and to participate that way. So we've gotten really creative with, if you don't have technology, you don't have internet, it's okay, we will find a way. I think with Doug's group, I think they went to some of the houses, set up hotspots for them. So we've done different things. Of course, it all depends on the budget, which, you know, I see, you know, Kristen has jumped right into the feeding of the families. And when we work with sites, we say, do what's within your budget. If feeding the families now is an issue and you don't have the budget for it, but sometimes some of our rural sites are driving out and delivering food, or some of them have gone to gift cards to get them. So with each site, we've been working very intensely to say what's going to work in your site. What happens in Detroit, in urban, you know, Detroit is very different than what's going to happen in, Doug, where was the first site in Colorado? Little itty bitty rural center, was it Center? Colorado? He's muted, but it was a little itty bitty place, right? And so those 2 areas are very different about internet. They're very different with how you get food there, how you get supplies there. But we do work to, because as you know, the food and the incentives and things like that, those are just ways to break down those barriers to get to families. So they are not an absolute essential to the program, but they are highly suggested. But we work with that.
Can I add a point for what Kathy mentioned as well? Because in the context of the question, there are 2 things, at least from our perspective in terms of the work that we're doing it in different countries. There's an affinity and a big demand from families to get tips now more than ever before. But I think it's also sometimes the content of the program and the intensity of the program that might be a determining factor in terms of what works or not. So there are different sort of intensity of content that can be availed. There are light, direct parenting tips, and this is things we're doing as interagency platform with UNICEF, with WHO, just direct things on a specific thing that you need in terms of you're facing. And I would share with you the link in terms of these direct links where parents, so I have a problem with my child spending too much time on the internet. I need that specific tip, this specific tip, this content. These exist, and there's a lot of them that we have developed, and they're there. There are parents that, you know, once you get this and then you reel them in, they might be interested in taking more intensive programs. And this could reel these people in terms of going in terms of more intensity programs. So there are leaflets, there are booklets, there are snapshots and parenting tips that exist online. And there are families that can be, and this is how we do it in the strategy, because SFP 10 to 14 is one of the key programs that we are also, you know, putting even before COVID-19 for families. But some families cannot invest 7 sessions. But so basically when they take a lighter program, oh, that's what it is about. They might divert, take more, get more. Or some of them will take SFP 10 to 14. But I took this, but I need that specific hint. They can this and they can take a booster. So there's also a spectrum, you know, within the context that can allow for different parenting needs and cater for the different needs of, and not only in terms of content, but in terms of how much they can engage to avail, because the demand is more than usual. We had a hard time engaging families before, tell them what family skills about. Now we have families asking us, now we need help. And this is a different context we're working with, but maybe they cannot stay as long. So the links are available for these self-led tools with all parents. I mean, I'm using it myself, and we can avail them to all. I just wanted to add that context to what Kathy rightfully mentioned.
Thank you, Wadi. I am. I have, there's a question for you here, Kathy. How long are your weekly sessions, and are you still doing a parent session, youth session, and family session?
Yes, we are, but we're breaking it up so parents and youth are not at the same time. There's lots of issues with that, with technology and feedback, and if they've only got one device, and if they're in a car and things like that. So we've broken it into, usually youth are on one night, and then parents and family are on a different night. So all of these things are the things that we've tweaked along the way, and that we will be evaluating to see what is working, and do we have any of the same outcomes that we had before. I think right in the beginning, we were worried about, let's just get to families. Let's get them help. Let's see them in their environment to make sure they're okay, that they're safe, and to see how we can help them. And now we're looking at that long-term, is this another way that we could deliver this program? But we don't want to do it unless we know that we've got some outcomes. Sorry, Doug, I think you were going to talk. I'll be quiet and let you talk.
No, I wanted to acknowledge what Kathy's been doing with SFP 10 to 14, and it's the kind of flexibility and adaptability that I was noting early in my comments. It requires practitioners and researchers to work in concert to be able to make the changes that might be required. One of the other things that I'd like to acknowledge has to do with question number 3, new skills and practices, and what that I believe is a greater focus on parents' own self-care skills. Parents are going through this pandemic themselves. Oftentimes these family programs focus on their parenting skills, which are essential, and provide some training, some opportunities to help them learn about staying calm, for example, while they're parenting. But we're in a different kind of condition, and the stress that they feel because of the COVID-19 pandemic requires individual skills on their own part to be the kind of parent that they want to be. So skills such as mindfulness skills would be one example. Other kinds of self-care skills are critical in reaching out to parents and integrating that into the kind of programming that you're doing.
Thank you, Doug. That was actually going to be my question to you all. I mean, Kathy, you were also mentioning at the beginning how there's not a shift, but also not just focusing on substance use, but also including the communications part and communicating with the children and building unity in the family. So given this situation, and now of course Doug gave us this introduction on how important it is for parents also to take care of themselves. What other kinds of skills are you trying to build right now for families through the program that are important, that maybe before, because the context was different, because before kids were in school, they were out of the house, relationships were different, but now they're all in the house and they're communicating differently with their peers, and they're missing out on stuff, but there's stuff that is new also that is coming. So how is that being addressed through the program or through the methodologies that you're using now?
Thanks, Maria. What we're seeing, we're not teaching anything different in terms of the tools. So again, if you know SFP 10 to 14, you know we talk iMessages. We teach parents to do that within the first 2 weeks. What we're hearing a lot more from the kids is that the parents, rightfully so, I get it, they're yelling a lot more at home. There's a lot more stress. There's a lot more conflict. The siblings are fighting. The caregivers are not using calm techniques when dealing with their kids. And so those are coming out in examples all the time. And so we're just reinforcing the tools that we already taught. So with iMessages, we're talking sometimes, just COVID specific. We're still teaching the same tool the way it was, but we're saying, okay, think about this. So, you're not leaving the house. You used to be able to escape and go to work and then come home and have a few hours. And so we're just talking a lot more about that communication, and truly, like with the, in parent 1, and then in, I think it's youth 3, we talk about stress with each of those groups differently, and how to deal with stress. And again, we're not teaching things differently, but their examples that they're bringing up to us are all COVID related. And we are just, we're just talking about we're just changing our examples really more, but we're teaching the same tools. We have not changed any of the curriculum. We've kept all the core components. We've had to change a few of the icebreakers because we just cannot do balloons in the air when we're all sitting in our own residence, things like that. But, our 7th session is all about resources and finding support. That has become critical, where sometimes I think before we just pushed through that session really quick to get them through that graduation. And now we're spending more time. And I've asked sites to do things like, in addition to their normal resources they hand out, do a COVID specific sheet on where to get testing, where do you go, even though they might have know there's a food pantry somewhere, really pulling those out, anything to do with COVID. So again, in my view, we really haven't changed very much in the curriculum. I'm gonna say it's 95% the same. It's really just the icebreakers that we've changed because the tools were already all there. Mm-hmm. We taught listening skills before. And again, we're just reinforcing that, saying, listen to your kids. They're upset. They can't see their friends. They're struggling with school online. They cannot get away from their siblings. Now we're just going to hone in on those skills and keep teaching them the way we used to. Now my sites might say different, but I feel like we're still teaching those same tools that we always taught, but just bringing in different examples.
Thanks, Kathy. Wadi?
Just to complement, because Kathy is right. I mean, the parenting skills should remain the same and the skills should not change. But also we have went through that exercise ourselves in terms of minimizing, in terms of the minimum set of needs that are particularly important during COVID-19. And the main things that we are focusing on in terms of the content of material in this current context we're living in is how to deal with stress as parents and how to recognize stress in the children. Listening to children and talking is an essential skill in this current circumstances. Valuing both love and limit, which is exactly what SFP 10 to 14. I think that specific skill in this context is important to emphasize. And reinforcing good behavior is also a skill to focus on. Focusing on relationships are also important in this context, and having and focusing on specifically dedicating opportunity to play and to engage with the kids. I think in that specific context, these are the main 6 things that we're trying to kind of hammer on, as key priorities in the context of COVID-19.
If I could throw something in there, And Doug's laughing right now saying, see, I told you once you got her talking, she wouldn't stop. But when the opioid crisis really kicked in a few years ago, I was asked to sit on a panel and with a bunch of the different developers of evidence-based programming. And the person who was heading up the panel said, we want you all to come out with opioid specific, you know, you need to change your programs and come up with opioid specific prevention lessons. And all of the developers said, we already have the skills there. It doesn't matter if it's opiate, if it's meth, if it's alcohol, we're teaching peer pressure resistance skills. And with me, the way I kind of think about it is COVID-19 is just kind of the drug of the day. It truly is. We still have the same skills, the same program. It's just the newest thing that in our examples we need to bring out. And I think that goes with most of the programs out there. We teach skills. We don't teach to a specific drug. We teach skills. And once you have those skills within you, you can function and get through all those different things.
Absolutely. That's true. I mean, the fact that you are able to transfer, let's say transfer the skill with another example or use the skill through another example just demonstrate how those skills are really important and necessary for different circumstances. It's a very particular thing. Thank you, Kathy. Zilly, is there anything that you would like to share with us?
No, this is a wonderful discussion. Thank you so much. I liked Ellen's Welch's last comment, guacamole. Yeah, no, I think even obviously these interventions go beyond substance use as outcomes. We're helping children to develop in a very positive way to address lots of things stresses they're going to address in their lives. So I want to thank you for the presentations. I just think this was, the questions were great. Thank you so much for attending this talk.
Thank you, everyone. Thank you, Kathy, Doug, Whitey, for being here, for sharing all your knowledge and your experience. And so thank you, everyone, for participating and with so much attention and for your questions. Just to let you know, we will be sharing the recording of this session. It'll be up on our website tomorrow. And you can also subscribe to our website to receive our nuggets that are little pieces of information about prevention and prevention science and practice that we put out weekly. And you will also get to see some prevention portraits, that is some interviews that we do with researchers and practitioners in prevention. Actually, Doug's portrait is up on the website if you want to check it out, and where he also gives us very, very valuable advice to parents on how to navigate through this whole situation right now. And you'll see more resources in there as well. Together with this presentation, I will also post some links and resources that are going to be useful that apply to what was discussed today for you for your reference and future use. Thank you, everyone, again, and we'll see you next time. We will be posting tomorrow what our next talk is going to be, and it's going to be pretty much on the UNODC international standards, where all the evidence-based interventions are presented, and also the European standards for quality implementation of programs. So we hope to see you soon, and thank you again.
Thank you, everyone, for joining.
Thank you, everyone.
Thank you.
Thank you for inviting.
Hi, Pablo.
Kathy.